and don't talk hereafter. So first of all, listen my first rule. If I given you a weekend work, that doesn't mean you will write 10 to 15 pages. I need minimum, not maximum, I need 4 pages, that's it. Your notes can be as simple as 4 pages content. Just to summarize the points, that's it. Read the points, summarize and write only the important things, that's it. You need not to write everything, right? So I'm not expecting entire notes and I'm not that cruel. So don't expect those things and I will be very friendly. But you should write good answers in the exam, okay? Yes. Maximum 4 pages, that's it. You can even go up to 1 page answer. Everything in 1 page, but it should cover everything. So that is the challenge for you. So coming back to National Health Mission. So Unit 1 is always focusing on National Healthcare Mission, policies, issues, how we are delivering the healthcare and various programs initiated by Indian government, right? So initially we discussed about the levels of healthcare that include primary healthcare, then secondary and tertiary. So India's approach is always from bottom to top, starting from villages to the urban and cities. So in the villages we have 2 types of workers. One is ASHA workers and another one is AWS workers, that means Anganwadi workers. So last time I haven't discussed the ASHA full name. So the full name of ASHA is, write down ASHA, ASHA workers. It is called as Accredited Social Healthcare Activist. Accredited Social Health Activist. Accredited Social Health Activist. It is the full form of ASHA, and AWS stands for Anganwadi workers. Anganwadi workers. And last time I also discussed about the mission goals of Indian healthcare mission or a national healthcare mission. So what are the goals of national healthcare mission? Yes, quick. National healthcare mission. So what are the goals? Tell me students. I already said to you in the last lecture. What are the goals of national healthcare? Yes. The first one, improved access of healthcare to primary healthcare centers, secondary healthcare centers and tertiary, okay, especially focusing on primary and secondary. Increased, I didn't get it. Increased workforce. Next one, increased workforce. Very good. Reducing mortality rate, reducing child and mother mortality rate. What is the meaning of mortality rate? Death rate. So there is another word for mortality. These 2 words go hand in hand. The other word was morbidity. You know what is the meaning of morbidity rate? Morbidity. Morbidity. M-O-R-B-I-D-I-T-Y. So there is a difference between mortality rate and morbidity rate. Morbidity rate means the occurrence of diseases, number of people affected or number of deceased people is called as morbidity rate. Mortality rate means death rate. Deceased rate is called morbidity. Death rate is called as mortality rate.
So what's the difference?
Listen, let me say, now none of my population will die post 60. I say my mortality rate reduced. The rate of death has been reduced in my country. That is fine. But how much of the civilians are in healthy state? How many civilians are in diseased state? Out of 100 civilians, how many people are ill? 10%, 20%. If there are 20% of fever population or diseased population, that 20% can be stated as morbidity rate. Or simply I can say suddenly there is a COVID pandemic and morbidity rate has been drastically increased. People's morbidity rate, that means number of people admitting in hospitals or deceased. Any more doubts? Yes, she is still coming.
I'm so confused because this is disease there. Like when you say someone is unrated.
Now, not all deceased patients will die, never. Hospitalization,
Or disease activeness. Oh, that's
just disease, you will recover eventually. Say, oh, not all diseases lead to death. Alright?
Disease, like what disease?
Yes. Any more doubts in mortality and morbidity? Yes, Mr. Alex. Doubt? No, right? No. Is there any doubt? No. Yes, Daniel. Oh. Oh, sorry, I understood. Disease. She thought disease means dead. Or no. I am trying to say DISEACD. Ill rate. The rate of yeah. Oh, in English we have these issues. Anyway, remove that Berlin wall or China wall. Remove your bag. I can't see you. Yeah. Everyone pay attention. Take notes. Write the points because these points you need to write in the exam. Okay. Tomorrow if I am giving you less marks, you can show your notebook, your today's notes. Sir, you taught this and why you reduced your marks, okay? So please take notes when I am teaching. That is for your own safe side. Don't trust me. Anyway, yeah. Where am I? Goals of National Healthcare Mission. So first one, improved healthcare access, especially to the primary healthcare centers and secondary. Then increased workforce and decreased child mortality rate. Also morbidity rate. Okay. Reduced occurrences of illness. Yeah. Next one. What is the fourth one I said?
Reducing
Very good. Reduced communicable diseases. Occurrence of communicable diseases. Okay. Communicable and non-communicable diseases. Can you tell me what is the difference between communicable disease and non-communicable disease? Yes. Contagious. Communicable diseases are contagious and non-communicable, non-contagious. Examples of communicable? COVID, very good. Non-communicable example? Yes. Huh? Flus. Yes, flus also. COVID also a type of flu, we can say. Very good. Malaria. And non-communicable disease example. Yes. HIV. HIV is a communicable. It is a communicable. I think she was confused between infectious and non-infectious. I guess. I don't know where she is confused. Non-communicable. Yes. Urinary tract infection. Now, even basic example. Yes. Cancer. Yeah, cancers are non-communicable. That means they are not contagious. They are, genetic level and lifestyle issues. Diabetes, non-communicable. Huh? That is called inherited. Inherited is different from communicable and non-communicable. Got it? Yes. Yeah. Any more you want to add? See, there are multiple things. Since you are first years, you are confused. Yes, miss. Blood pressure. Very good. Hypertension, we can say. Hypertension is a non-communicable. It's a condition. It's not a disease, but still you can consider it. Condition. Yes, miss. Asthma. Yeah. Enough. I appreciate every one of you. Good examples, correct. I hope you got some idea, right?
Yeah.
Communicable and non-communicable. Very good. Next one. What is other goal of this one? Huh? Yes. Implementation of universal immunization programs. Universal immunization programs. These are the main missions and goals of Indian healthcare mission, and it has tremendously achieved all these goals, by the way, successfully. So listen, there is one important thing I need to discuss here. See, for any non-developed or poor country to get a status of developing country, okay, a poverty country to the developing country or to the developed country, the first and foremost thing is what is the status of their healthcare facility in that particular country. Are the civilians getting free, affordable, complete medical care by the government or not? If government cannot give healthcare facilities, then how the people will uplift the nation? The status of a developed country directly proportional to the healthiness of the population. If population not getting right healthcare, then the country never develop. When I say healthy, that includes not only healthcare but also nutritional support by the government and financial support by the government. Nutritional support, I am saying again. And one of the hidden thing in this one is nutritional support. The national healthcare always gives at least the minimal nutrition a citizen requires for free of cost. Rations. India, we have very good ration policy. Almost every one of us are benefited by, are eligible to get a one or another type of rations, either rice or at least some pulses. Okay, dal in Hindi. Yeah. So nutrition support should be there and healthcare support should be there for any country to develop. Okay. Yeah. So I want to tell some achievements of Indian healthcare delivery system or national healthcare mission. That include India has successfully implemented improved access to the healthcare to the up to the villages. There is a very stringent policies to bring each and every healthcare facility up to the village level with the help of ASHA workers, Anganwadi workers, ANM workers, and many people. Okay, programs, pulse polio program. India has a very strict pulse polio program. Every person mandatory to get a polio vaccine. It's a oral vaccine. So since I got a polio, I need to tell one interesting story regarding polio. Listen. Even the scientists or the policy makers knows how to reach to the village. Listen, there are two types of polio vaccine. One type was you need to give a killed vaccine intravenously. You need to give an injection, and that is a killed vaccine. When I say killed vaccine, the virus was killed and we given vaccine to the patient. Second one, live attenuated vaccine. Live vaccine means the virus is still alive but it won't cause infection to the body. But we will get immunity against the virus. The virus is alive. Okay. Now I want to tell you the life cycle of polio virus. The life cycle goes like this. So polio present to a person. Now this person polio will survive in the intestine, in the stomach. When the person going for fecal matter, he will discharge the polio. From this fecal matter, if any fly land on it, the fly will carry the polio virus to the next person. Now the second person will get affected by polio and it will become a communicable disease. That is why polio will spread to the population. And I hope you know the effects of polio. Your limbs will be paralyzed. And you can't walk. We can't walk, right? So what India did was, they have a risky live vaccine and a safe, costly intravenous vaccine. Okay. So what India did was, we opted live vaccine. It has some risks, but still we opted live vaccine. By the way, I said wrong. Live vaccine is costlier than killed vaccine, because you need to maintain the liveliness of the virus in a vial. That means you need to have a cold storage, you need to monitor. Live vaccine is very tough. So why India opted live vaccine? I will let you know. See, there are some people who are very arrogant, some of our grandfathers. They won't come to the hospitals even though there is a strict guidelines to get vaccinated. Am I correct? These people won't come to the hospitals to get vaccinated. How to give vaccine to them? We can't manhandle them. That is not, every citizen has a right of his own freedom, his liberty. What to do with those people? Or like some tribal people, they don't want to engage with society. But they must get vaccinated. What to do? Any idea? And we can't manhandle them. We can't force them. So what we did was very clever approach. Nearby city population must be vaccinated. Simple. If there is a village there, I will go up to the village where they are accepting for the vaccine. I will vaccinate the neighboring villages. Now listen, what vaccine I given? I given a live vaccine. Okay? Now this live virus will be in the stomachs of these people. Now they are going for defecation. Okay? Now the live virus started communicating in the population. Now it is spreading in the community. Now what type of infection spreading now? A live vaccine was spreading. A live virus. But what type of virus? Safe virus. Because we given safe virus to some people. Now these people are acting as a biological carriers of vaccine. You got my point? So rather than using a evil virus, now we are using a friendly virus and let the friendly virus spread the infection. Now everyone develop immunity, that's it. Tomorrow even actual virus coming, they are immunized against the actual virus because they are given vaccine shot passively. Okay. Yeah, pulse polio is one of the tremendous achievement, and today for past 5 years India don't have India has a 0 case of polio. That indicates India is one of the India's 7th country globally to eradicate polio. So we have succeeded because we opted a costly, risky procedure and we made it. So it needs more funds and we kept the funds for a right cause. So yes, there are some good things. And India also reduced mother and child death. The rate of mother and child death has been drastically reduced for past 5 years because of the stringent policies. And also public facilities has been drastically increased. I can proudly say to you, right now if you get a fever, you can go to the civil hospital just some 2 kilometers away from our university. And that hospital has everything, all facilities for free of cost. Even for internationals, not for nationals, keep in mind. Every citizen, just your visa is passport is sufficient, I guess. You will get a free treatment. Yeah. There are some good things about mission, Indian mission. Then let us go with other interesting thing. Yeah. Everyone write a table. Issues in healthcare. Yes, we must criticize, then only we will understand the gaps. We must critique. I think you both are not listening to my lecture. That's why you are smiling there. It's simple. See, one of the things that a faculty will develop the skills, okay, apart from our teaching is understanding your mindsets. Just by your eyes staring, I can understand your status. Anyway, issues in Indian healthcare, write down. Issues in national healthcare. So the table goes like this. There are 3 columns in this table. Write a table like this. See, when I'm studying my BSc MLD, I don't have teacher like me. Our teachers never taught us. They are very serious. You should feel proud that someone taking class here. For me, only 1 class per a week. That too, once in a blue moon. Very tough. Anyway, Yeah, write down issue in the first tab, issue. Then second one, proposed solution. So not only criticizing, we must give a solution, that is a healthy learning, and expected outcome. Expected outcome. Expected outcome. Write down. The first issue, write down infrastructure deficiency. Everyone knows infrastructure is one of the major problem. Infra deficiency. So infra deficiency, that include equipment, hospitals, everything, something related to infrastructure. So what might be the proposed solution? What is your solution? Let me know. How to increase the infrastructure in a developing nation? What is your thoughts for solution to this issue? Yes. You don't want to say. Listen, the policy makers or the central government, the policy makers in the central government, why they only allotted a 1.6% GDP when the same India allotted almost 38% GDP to the defense. See, India is affordable, it has money. It is spending almost 40% in the defense category. But why not to the healthcare? Can't they able to increase up to 5%? We are not asking 20. Can't they? They can. But why? Because there is no vocal voice by the civilians. We are blindfolded. That is one of the issue. So there must be policies to invest more, to increase the more fundings, to increase more number of PHCs and secondary health centers. We don't want tertiary centers, keep in mind. Tertiary centers again, they will be located in cities, and cities are very less. In a country like India, we have more villages. So our always first priority is always villages. If villages has good infrastructure, everything will be best. So yeah, there should be better infrastructure in the villages, that means in the primary healthcare centers and secondary healthcare centers. If you bring infra here, everything will be resolved. Right? So outcome. It will increase access to healthcare to maximum of population or civilians. So personally, I have one dream. My dream was, why can't we bring a medical lab under the umbrella? Lab under umbrella. Can't we able to do all the lab tests under an umbrella on a street? When India has so many street food vendors, can't we able to convert a street food cart into a medical lab? Can't we? We can. When we have a pregnancy test that can be done at home for 30 rupees, a sophisticated pregnancy test, okay, just a urine drop will give positive or negative. And most of our lab tests are just card-based tests actually. You give one drop of blood and it will give positive or negative result. Why can't we compile all these cheap and cost-effective techniques into a simple lab under umbrella? Why there is no such concepts? And these labs can be easily deputed in the villages that can fill the gap. Why there is no right research in the right direction to make it cheap and affordable? Yeah, we need to re-question ourselves. Not only criticizing government, as a lab technicians, what efforts we can do to develop our own profession, our own field. When we are not taking initiative, who will take? Rather than blaming each and everyone. Yeah. Second one. Yes, I'm not telling you, okay. I didn't tell you personally. Yes, second issue. Workforce. Obviously, this is another issue. Last time I already discussed workforce related problem. So, yes. So workforce shortage is there in India also. The problem why we have workforce shortage, because there is a shortage of education sectors in the particular domain. Right? India is always focusing on engineering education, moreover healthcare education. And paramedics like us are very rare. We listen very rarely about an MLT or optometry or these sectors. Why there are no funding in healthcare? Why the school children are not giving awareness for other paramedical courses? Always school children are said only these two. Either you become engineer, lawyer or doctor. But they are forgetting to say these things. A medical lab technician, a dialysis technician, very important. There is a shortage of dialysis technician, anesthesia technician, operation theatre technicians. So where are these people? Unless and until there is no awareness, we can't uplift our healthcare sector. The reforms should come from the schools or from education. Yes. So workforce shortage is there. So the resolution will be increased educational centers, increased CME. There is something on continuous medical education and medical awareness. There should be an awareness to the school children regarding the significance of our courses. Most of you might not hear about MLT when you are studying your schooling. That is the issue. Why there is no awareness? The lack of awareness is one of the issue. Then third one, financial barrier. Financial barrier. So financial barrier to the individual citizen, and this financial barrier can be resolved by giving a national-wide healthcare insurances, central government level healthcare insurances. Okay. Last time I said an example to you, bike insurance. When India focused on bike insurance as a mandatory protocol to repair the damaged bike, why they are not focusing to repair a broken civilian? So yes, there should be a insurance policies, and this is the difference between Indian and foreign or developed countries. Developing countries don't have healthcare policies, healthcare insurance policies. That is the major problem. Yeah. So then I want to tell one more thing, since we got a developed country issue. Listen, the best country we all think is America, for example. We think that America has the best education. At a cost of what? Americans getting education free of cost during their learning process. The government will invest on you, but after you are getting your job, your completion of your graduation, you are in a huge education debt. Now you need to repay the debt. If not, the government even paying the taxes, the interest, as long as you are not repaying the debt. So at least that problem not there in India. The debt issues.
So most of the time they want to that they place you, they equal work, and then ask them to take it.
Exactly. But still, listen, that is a very dictatorship, but still a disciplined approach.
Yeah.
Because I will give you one best example, the same classroom. When I am taking class, some 30 to 40% of you not listening to me. Because you got a free of cost money from your parents, and you need not to worry about the burden of financial matters of your education. That's why you are not listening, because you are irresponsible, reckless, lazy, and unaware of your parents' burden. Yeah, I'm scolding you. It might not sound like that, but I'm really scolding you. Yeah. So yes, there must be a government punishments like debt policies. Then only things will uplift. I think it's recorded. YouTube people will. Anyway, next one. Next issue. Access to the advanced technologies. Access to the advanced technologies. access to advanced healthcare technologies. Access to advanced healthcare tech. Still that is a challenge to us because these machines cost a lot. And India is still trying to bring its own thing called Make in India policy. It's been there for past 8 to 9 years. But Make in India is still focusing on transport sector, where we are making national brands, national equipment. But there is a gap in nation produced healthcare equipment. So yes, there should be a government initiation of healthcare equipment also. Still this equipment is abroad and they are costly. That is one problem. Yeah. Fifth one. Quality of care. Quality of care. Most of Indians will agree with me. The reason why we are not going to government hospitals or we are afraid of government hospitals is the quality of the care is very less. It's very, pathetic condition. Doctors won't be available on time. Equipment won't be functional. So there is a lack of uniformity in the system. So this is one of the issue. And we need, only God can help us in this issue. So there should be stringent policies to make the system uniform. The another issue we have was, what I'm feeling was, there is no paramedical council. There is only one medical council, and medical council alone cannot run the game. When I say medical council, they are only bothering about physicians, that means doctors, and their treatment. But if they are not supporting the paramedics, how the system will run smoothly? There is no helping hand to the paramedics. Unless and until there are policies to uniform, to bridge the gap between paramedics and the mainstream medical practitioners, we can't make the system uniform and we can't run the system smoothly. So yes, that is one of the solutions. There should be a policies and councils for all paramedical courses, and all these courses should be streamlined into a single uniformed working system. That is one of the issue. And last and final, public and private relations, PPP. Public, private and what is PPP means? Public, private, there is one word. Partnership, correct. Thank you. Partnership, public-private partnership. Yes, very good. So this is the idea, where the government should partnership with private, and there should be a streamlining of this process. Okay. Yeah. So these are the some issues and possible solutions and the expected outcome. So I need similar answer in your exam. You need not to write that lengthy, boring paragraph answers to me. Okay. Don't by heart anything. Just to know the headings. Accordingly, you can construct your answer, right? You are already trained in this for past 12 years of how to write. So don't ever, disbelieve your confidence. You are capable enough to construct right answers. Yeah, thank you very much. This is sufficient for today. Yes. Let me take my attendance now. Yeah.